The World Health Organization African region carries a disproportionately high share of the global malaria burden. In 2022, the region was home to 94% of malaria cases, which is 233 million, and 95%, which is 580,000 of malaria deaths. Children under 5 accounted for about 80% of all malaria deaths in the region. 4 African countries accounted for just over half of all malaria deaths worldwide. Nigeria came first with a figure of 26.8%. Secondly, Democratic Republic of Congo with a percentage of 12.3%. Thirdly, Uganda 5.1%. And the last and not the least is Mozambique with a percentage of 4.2%. The first symptoms may be mild, similar to many febrile illnesses, and difficult to recognize as malaria. They may include fever, chills, and headache. If left untreated, Plasmodium falciparum malaria may progress to severe illness with symptoms such as fatigue, confusion, seizures, difficulty breathing, and even death. Infants, children under 5 years, pregnant women, travelers, and people with compromised immune status are at higher risk of severe infection. It may interest you to know that malaria, despite all this, is preventable and curable. Today, on your favorite health TV talk show, the physicians will be talking about malaria, the body, treatment, management, and of course, prevention. We'll be right back after this timer. This is 10. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memina Yusuf Kadri, and of course, on this show, I always with my co-hosts and the amazing, delectable Dr.
My name is Dr. Maxine Agberi, and welcome to The Physicians, where your health is our business.
I will always be our business.
Will always be our business.
So today we are focusing on malaria,
The burden of disease.
everything about malaria. And
In your intro, something very striking, okay? You said according to the World Malaria Report, right? We had 249 million cases of malaria in 2020 compared to 244 million cases in 2021. So that is this.
yeah, it's an increase. And so you want to now look at why the increase when the world we are still focusing on, on the 5 malaria treatment, malaria, rollback. There's just a lot of malaria initiatives. So why are we still having
the most I don't want to use the word annoying or surprising was when you said that 4 African countries accounted for just over half of malaria deaths worldwide. 4 African countries and Nigeria number 1. With the rollback malaria,
and so with so many non-governmental.
So the truth is that I don't think I don't want to blame government again, because I just remembered that there was a time they divided the insecticide treated nets. You know what happened? The people that they gave to were using that with fishermen.
Yes. They were using the nets for something else. To ask the question why they had to use the nets for fishing. They said it was stronger. In 2024, Egypt has been declared malaria free.
Oh my goodness.
So I know if I would be holding back, you don't say it, not to say it. Malaria, which is an American country,
so it's doable. So if it's doable, it just means that we as citizens,
we have to do something.
Yes, we have to do something. We are accountable.
Yeah.
Because
my major worry with malaria is the under 5 death. So children that have not even achieved, they are just beginning to say, okay, where am I? What do I need to do? Papa, mama, then they are gone. And we are talking about the future generation. If malaria is already
wiping them,
then what are we talking about? It's preventable and curable.
Yeah, but if children under 5 are dying, if children under 5 are dying, which increases mortality, pregnant women. So who is accountable? Who is not doing what?
Malaria vaccine. So
There's now malaria vaccine. The polio vaccine we are talking about, we had not yet done with this. The malaria vaccine.
who is going to, lecture us?
People begin to wonder, why are you talking about malaria? Why are you dying of malaria? Why are we even discussing malaria in 2025? I will be discussing it. We'll be discussing it. And it is the next 6th, there's the World Malaria Day. Yes, roll out the drums. Oh, there is an expert in the studio that is going to help us unravel this disease ordinance. Say what are the ways individual, communities, government, non-government, like all of us collectively can deal with this. We'll be right back after this time at 2 stage.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you're just joining us, this is Self-Repair Health TV Talk Show, the physicians, where your health is our business. Today on the show, we are going to be deep talking about malaria as a disease body, the recent trends, the current treatment, generally, and of course, the prevention. With us in the studio today is the amazing and lovely Medical Women Association member, who is no other person than Dr. TIMSON. She's a general practitioner and she works with the CBA of the Naval Doctrine Command on the cantonment here in Lagos. Dr. TIMSON, you're welcome.
Thank you very much. Welcome, Dr. TIMSON. Thank you. Love this smile.
Yeah. And soft spoken.
Yeah, very soft spoken.
Dr. TIMSON, we are worried about this malaria thing. In 2024, they said Egypt, just 5 hours from here, has been declared malaria free.
The news.
But our own, half of all the death of malaria worldwide, Nigeria is CDG with over 26 point something.
Four African countries.
For Africa. And Nigeria is number 1. Wow. But before we go into malaria as a disease body, let's just share with our audience what is malaria and how is it transmitted?
Yeah. Thank you, my hostess. I'm glad coming around once more to talk about malaria. Yeah, I will define malaria as a kind of a systemic illness that is caused by the bites of an infected female Anopheles mosquito. If I want to go on a bit, I might say usually it's a viral illness as well, just like Dr. Kaji told us at the introductory stage.
So what is that?
Yeah, the infants, the under 5s, the pregnant women, the foreigners too, and those that are not actually living in malaria or any region
before. So those people, are you saying like Nigerians that have left Nigeria for a while?
No.
Okay.
Nigerians that have left Nigeria for a while are already immune.
Okay. So if for example, now I've left Nigeria for like 10 years,
yes,
and I'm not coming back, can I still have malaria?
How do you say that? Yes, you can still have malaria. But the severity will not be as much. You not play. You understand?
So they may take malaria shot before coming.
It's maybe advanced.
Okay.
Yeah.
Okay, so now you already talked about what malaria is all about, the bites of
An
infected female Anopheles mosquito.
So I just want to hide that part of the female. Why is that? It's the female.
That is the cause of the malaria.
But next you will say that we have malaria. This is what we have. Cause. So now let's talk about the symptoms of malaria, because oftentimes some patients actually just come see you in the clinic and they tell you, doctor, I have malaria. and you ask them, why do you think you have malaria? And they just read out, I know how I feel when I have malaria. It's usually how I feel. It's usually how I feel. You need to do any investigation? They'll say, I don't have to do any investigation because I know how I feel when I have malaria. And to compound it, it will even tell you both malaria and typhoid.
Yeah.
That is another story for another day. So we don't want to tell you as a practitioner what are the symptoms that patients usually will present with, and the real things that cause like a day fever, the illness. What are the symptoms?
Taking on small. Actually, you have fever, which I don't think I have to go down to the full meaning of fever. You have fever. The fever can be associated with chills, rigors, and anorexia. You have headache, not constitutional symptoms. Fever with constitutional symptoms. What is the constitutional symptoms?
So break it down for our viewers.
You have headache, generalized body pains, malaria, weakness. Let me stop and cast.
So those are just the symptoms. The symptoms you have this malaria.
How about these bitter taste?
The body about that starting up because they sing about not wanting to eat, feeling as if they want to vomit.
Yes, I actually mentioned and read that initially. Then the bitter taste is come. It's usually it takes some time before the bitter taste actually comes in.
Okay. So do you want to, so that they can understand it, you want to break it down?
Yeah.
At the initial stage, these are the symptoms.
Yeah.
Then as it progresses, this is what you're likely to experience.
Yes. At the initial stage, you can have that kind of malaria, some body pains coming on gradually. This anorexia of a thing can be there. Then later, can progress to all this time, bitter taste, fever. If not arrested at that moment, you can have some other symptoms and signs from other organs.
I think it would be injustice if we are talking about malaria here and we are not educating Nigerians that malaria and typhoid are not sick. And we in this studio and hosted this program week to week, back to back for years now, it's good for us to emphasize why Nigerians should stop using that statement. I have malaria and typhoid. Dr. TIMSON, please speak to our audience that there's a difference and what differentiates it for one another. What is malaria? What causes it? What is typhoid? What causes it? And why people shouldn't be mixing them up. Because it's only in Nigeria we have people using that statement. I have malaria and typhoid.
Yeah. You have actually said the truth. Malaria and typhoid, they are different diseases, though their presentation may look very so much alike that you can. The most important way of actually knowing whether it is malaria or typhoid initially is through these pulse rates and even the pattern of the fever. The understanding that the malaria you have it depending on the type of plasmodium species that actually caused it. You can have the tertian malaria, the other one, the intermittent fever. But with typhoid, there's always a step ladder fever there. The fever keeps going on, even in spite of antipyretics and whatever. The fever keeps going on. That's with typhoid. That's number one. Or that was easier for any layman or know. And when it comes to health practitioners too, or the pseudo health practitioners, we can talk about the pulse rates. In typhoid, you expect that when somebody is running fever, you expect to have tachycardia, that's a increased pulse rate. Then typhoid, it may be bradycardia doing that. Then if we move on to the laboratory investigations for malaria, we always want to do either the blood flow or we want to do the RGT or the other type. You see malaria parasite, depending on the number, maybe 1+, 2+, or when we're talking of this microgram PF that we have now that we're using now, is a 0 to 40, 40 to 100, or something like that. But with typhoid, from blood film, you have leukopenia, that is lower the blood beast. White blood cell count, that's for the health practitioners. Then the other presentations for typhoid Yes, you can have vomiting like in malaria too. Then the typhoid, you can first have constipation before you can now start to have diarrhea. In malaria, too, you can have constipation and diarrhea. At least in laboratory tests will always be staged.
Even the mode of transmission, they are different. And what is responsible, one is bacterial,
Yeah.
and the other one is
Another one
parasite.
is parasite. Because while malaria is a female anopheles mosquito, the typhoid fever is the Salmonella typhi. So Nigerians, please stop using the word "I have malaria, typhoid." It's different. They are two different.
So after treating, they will come and tell you, because I'm not taking the antibiotics for typhoid.
Yes, that's the reason why. Yeah. So treatment coverage. Treatment here is WHO has said is still the same artemisinin-based combination therapy ACT. Whether we are going to combine it with one drug or two drugs to give us the treatments. We have a lot of brands in our country now, which I think our layman self can even give us more. Top down. But practitioners too. It's anyone you go for. I always advise us to take it regimented. We understand. We should be regiment about it. Take it as always once, be right. And then you need to avoid some other things around it for it to work very well. Stipulate those yes, let those things. Yeah. Fortunately or unfortunately, the artemisinin ACT drops, they get inactivated with antioxidants such as vitamin C, vitamin D. So because of that, we need to avoid some drugs while on this ACT. Even we need to avoid some foods and drinks such as it contains something like raw fruits and raw vegetables. Should try as much as possible to go off there while is eating malarious. Yes, Then when we talk of drugs, I've mentioned vitamin C, I've mentioned all these are multivitamin preparations. Unfortunately, there are vitamins and sponsors there. We are not saying we should not take them. I'm only saying during malaria when feeling like this, I bear those there lay off there. They won't talk of drinks, all these caffeinated drinks too. You should be very wary of it. They say, like if you are tea bars, you need to go off there. I also would like to mention cola nuts, bitter cola. Quite a number of us still take, they contain a lot of antioxidant that can inactivate the drug and render it useless. That's important. In the past, when we're still growing in this profession, you discover that you treat a patient and the next day the patient comes back and says, "Doctor, I'm still having malaria." And you send the patient to the lab really to check and they still have malaria parasite. Keep questioning yourself, what actually happened? Initially, I used to think, the patient were low compliance with their drug. But later I discovered that all these things that we take in drug get that answer. As there, I thank you for the ACC that you clarified, treatment options. And I know that's how the role of the chloroquine. Chloroquine, yeah, okay. Some people will tell you this one does not take off my malaria. Yes, it's a chloroquine that dies. So do you still advocate? Yeah, generally chloroquine has been off in treatment of malaria for a long time. I've not used it in a long while. Can't remember where it's sure. Maybe if you ask one or two doctors around, they can tell you, well, that's what I still use for my patient, but that's what works for them.
Before we let you go, it's good for you to kind of talk a bit about this malaria vaccine.
Yeah, yes. The malaria vaccine I let actually is in Nigeria. In fact, it's with the Lagos state government. Okay. But it's yet to actually come out because there is a health facility here in the Highland that actually needs it for the bulk of its patients because the bulk of them, they are foreigners. Okay. For one reason or the other, they have lost so many of them too. And then I know it's a surprise. Wow. But then Lagos state is yet to supply them. And even some of the Lagos state health facilities like general hospitals and national maternal and child health centers, they are yet to get a supply. It's never can tell with other high rising or high flying private hospital setups. Maybe those one have, but my research was unable to actually dig down there.
Okay, can you just quickly tell us about some of the complications if you don't treat malaria? What are the possible complications that can happen?
That can happen. Yes, thank you very much. Patient can go into shock. If
And because it's not just malaria.
shock are entered it, a patient can develop pneumonia if malaria is over to the moon. Like I said, is a systemic remedy, so it affects all the organs in the body. Like we can have severe malaria, cerebral malaria, it affects the brain, and the patient can be in coma, and before you know it, we can just from the severe anemia too can come from malaria by a long period. Keep hemolyzing, and before you know it, the blood level has really dropped. Patient has malaria, and
So I think what we have actually schooled us just for the sake of people that in Nigeria actually, is an endemic. It is area. So all of us here, we are all exposed to having malaria because of its endemicity. So people that are traveling in, they really advise that other people, the foreigners, to take the vaccine and see before coming. But unfortunately, some people will leave Nigeria, and it's when they get there that they come down with the malaria. Have you ever experienced patients outside or people outside that have malaria, how they are treated? Ah, It's usually very difficult. It's usually inside, yeah, it's arrest, yeah, turbulent. But they will isolate you.
Yeah, they will screen you. You are in it. But say, I didn't know it is malaria I have. Don't both it. Yeah, it's that typical intestinal tears. And I can't blame them. You want to put their population at risk. Because when they have herd immunity, it, now see that I know what I have. They will not come their fellow Nigerian. If you have that, yes, malaria. So I say it's good for people to know about the vaccine. Those are coming. It's good to always protect yourself for coming. Naturally, you just said that Egypt is not free. So very soon they were asking us what you're going to eat. But what to say? Yes, I hope you are not coming here.
sorry, on the preventive note, it didn't mention our environment.
Yes, please.
Which also are that very important. Please take care. We have a lot of water lots here. Mostly, and mostly it's not government, but government has given us water channels. We'll find our people throwing rubbish and everything and blocking the drains. So this makes this water to be stagnant. And malaria breeds very well, very stagnant water.
But there's a school of thought that says that it's the flowing of water that kills this. Like, as if yes, that is so because it's very selective. It doesn't stay in a dirty place. Yeah, it's as if but you have it for the flowing one was well do a lot. Okay, so do a lot. That thank you so much, Dr. Tins. I just want to go on and on and on because you are so easy to speak with, right? Very mindful discussion with us out there. Thank you so much. To our viewers out there, you've heard it all. Yeah, even though it's preventable and curable, people are still dying of malaria. And Nigeria is leading out of the 4 African countries that are found wanting to have half of the burden of malaria issues in the world. Now, Nigeria is CBD. So what are you doing about it? What are you ensuring that we do? Wear protective wears. Make sure if you're asking for it is not malaria, go test. Go and see a doctor. When they say take medication, take it. Also know that there are some things you shouldn't take when you are taking your anti-malaria. Like the vitamin C, vitamin D, and food too, like fruits and vegetables. The doctor will tell you what you should abstain from. So I don't say it's malaria typhoid. The physicians have told you that there's nothing like malaria typhoid. There's malaria and there is pycon. My name is Dr. Nice so Catherine, and until next time, remain blessed.
So thank you so much, Dr. Simpson, for coming on our program. I'm sure we'll have you again to discuss another very important topic issue.
And to our viewers, I just want to say thank you for being part of our program today. We discussed malaria, the burden of disease, and the signs, the symptoms, preventive measures. All I can say is that put a premium on your health. Take very good care of yourself. When you're at home, you can use the insecticide treated nets. Otherwise, you use the mosquito repellent at home. It will help. Even the one who have the ones that don't even have odor these days, can use all those ones. Anything that can help you. There are some creams that you can also rub in the evening, can also repel the virus there. Don't take it for granted. The little malaria you think, the little mosquito you see, that gives the malaria. You can see that little thing, the harm that it can cause. You can't even fathom it. So let's avoid this. Let's be like Egypt. Let's get to that level. Let's roll out the drums in future and celebrate Nigeria being liberated from number one at least, being the leading house of decks and children in the world. So on that note, I want to say thank you again. Remember to follow us on social media platforms. If you want to be our guest like Dr. TIMSON here, to send us an email. We'll welcome you happily. The next time, my name is Dr. Martina Agbeme. Goodbye.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.